So what's up guys? Tackling the first topic of drug education, Rance Livaris is on the action. But first, let me get dressed. Now that you've changed, let's tackle the elephant in the room, shall we? Let's go. Tale as old as time, as we all know that drug abuse is a losing game for its victims. It's either lurking or furtively waiting for its next willing victim. Ignorant and adventurous teens are the two most common victims of drug abuse, for they often venture out into the new unknown world of social outcasts, also known as the menace of society. Not only to the family, loved ones, or friends, but drug addicts lose their trust of themselves and minds. Their disorderly actions makes our place unsafe for living, and some may even influence the innocent to join them. Now, to know more about drugs and drug abuse, I will be passing the baton to my fellow squad mates to finish the lesson. Are you ready, Falcons? Make some noise!
When people hear about drugs, they thought it the wrong way. They thought that it can ruin our body and our future. However, drugs can also help us, especially our mind and our body, function well during an illness. But drugs have to be taken correctly and seriously in order to achieve the desired medical outcome. The wrong drug or the wrong amount of the right one can worsen an illness, destroy blood cells, damage the body, and may cause death. For this reason, most drugs can be legally purchased only with doctor's written order called a prescription. In prescription, the physician indicates direction on how much medicine to take, or the dosage, and how often should we take the medicine, or the duration. Prescription help ensure that medication are used safely and effectively. Doctors prescribe drugs based on their knowledge of your medical history, current health condition, and potential interactions with other medications. It's like a personal roadmap for your health, tailored to your specific needs. Plus, some drugs have the potential for abuse or side effect, so having a medical professional oversee their use adds an extra layer of safety. Taking drugs is very crucial because we need a proper prescription by the professional and a proper way of taking it so that we can really achieve the outcome that we desired. Having a prescribed drugs help us feel a sense of security because we can assure to ourselves that this medication or these drugs are safe to take since this was given by the professional, and we can take this safely with the help of our prescription, which was indicated how much dosage should we take and what are the duration of the drugs that we should take.
OTC must be used discriminately. First, to avoid dispensing of other drugs to known identified habitual drug users. Second, to avoid complications. This is done by inquiring from the buyer of the drug as to identify of the patient, patient's age, and other important information such as pregnancy, hypertension, and etc. Third, counseling the patient as to avoid the self-medication syndrome by inquiring about the buyer's source of information about the drug. Most drugs act within a cell rather than on the surface of a cell or in the extracellular fluids of the body. Similarly to normal body chemicals, a drug enters a cell and participates in a few steps of the normal sequence of a cellular process. These drugs may later interfere with or replace chemicals of normal cellular life, hopefully for the betterment of the person.
Drugs also help people's bodies and minds functions better during an illness. But drugs have to be taken correctly and seriously in order to achieve the desired medication outcome. The wrong drug or the wrong amount of the right one can worsen an illness, destroy blood cells, damage the body, and may cause death. For this reason, most drugs can be legally purchased only with doctor's written order called a prescription. In a prescription, the physician indicates directions on how much medicine to take and how often. The practice of taking drugs without proper medical supervision is called the non-medical use of drugs or drugs abuse.
Prescription drugs. These are drugs requirement written authorization from a doctor in order to allow a purchase. They are prescribed according to the individual's age, weight, height, condition, and they should not be taken by anyone else. It is a personal requirement and self-medication should be strictly avoided. The pharmacist therefore requests a prescription from a doctor before any medication is sold. So, kani siya is dili siya basta-basta magbay sa bisag-asa. And if magbay ka, you need to authorization gikan sa doctor. Pangitaan mo sa pharmacy, authorization gikan sa doctor, o reseta pod para ipakita sa ilaha para matagaan kanila and mapalit nimo ang imong medicine. And careful lang taani since kani siya na medicine is for you lang jud. And dili ni siya basta-basta mainom sa bisag kinsa, so dili ka makainom nga kani siya kay pwede sa imong dili siya mainana. Kay kani siya is naka-indicate rin mong age, weight, height, and condition nimo. So kani nga tambal jud is for you lang jud ni siya. And dili ni pwede nimo mainom sa uban nga kani siya natambal, so dili siya inana. Careful lang pud taani kung asa na to siya ibutang sa kay ang mga bata, so bawal pud ni siya sa ila. Yeah.
Good day everyone, this is Daisy Mayro Apalia and I have here with me the continuation for the prescription drugs. Once again, strict emphasis on the following directions need to be stated. In addition to dosage, the physician indicates both when and for how long the medicine should be taken. These directions are intended to safeguard the patient from needlessly treating himself after his illness has been brought well or brought under control, or from prematurely stopping medication because he thinks he is already well.
Good evening. Since the chemistry of the body is subtle and variable, only a physician has the responsibility of prescribing and directing the use of drugs in the treatment of illness. The prescriptive drugs are classified into three. The first one is the drug with prescriptions. It is the medicine that can be made available to a patient on the written instructions of an authorized health professionals. So these are the drugs that can only be bought by presenting a prescriptions that's signed by the doctors or any authorized health professionals. The examples of these are the blood pressure tablets, cancer medicine, and even antibiotics. The second one is the regulated drugs. This is the one that is researched, manufactured, distributed, and administered under the supervision of regulatory authorities and international agreements. A regulated drug has to go through extensive clinical trials, testing phase to prove the efficacy of the drugs. The examples of these are the alprazolam, midazolam, diazepam, and phenobarbital tablets. And lastly, we have the common, which is the prohibited drugs, or it is known as the illegal drugs, or the drugs that affects the way of the body functions. It's illegal because it affects the person internally and externally, and it also affects the way the person acts. The examples of this are cannabis or marijuana, which is commonly used by the teenagers. There's also cocaine and hallucinogen. Hallucinogen alter how a person perceives the world. Illegal drugs change the way a person sees, hears, tastes, smells, or feels. So these drugs are illegal because it changes the person acts. So the person that take the illegal drugs may feel or experience what we call hallucinations. So it is also dangerous for the person and for the other people because it is mostly the reason why a person commits a crime. And that's it for the report for the prescriptive drugs and the pre-prescriptive drugs. Good evening and thank you.
What are over-the-counter drugs or OTC drugs? OTC drugs are non-prescription medicines which may be purchased from any pharmacy or drugstore without any prescription from a doctor. They are used to treat minor and short-term illnesses and their symptoms including pain, coughs, cold, diarrhea, constipation, acne, and others. It should be strongly emphasized that direction be closely followed and all precautions necessary taken to avoid complications.
Uses of OTC drugs. So before we start, let us know what is OTC. Over-the-counter medicines are those that can be sold directly to people without a prescription. These medicines are readily accessible in local pharmacies, convenience stores, and even sari-sari stores, making them an integral part of Filipino life. From the common cold to headaches and fever, OTC medicines have become a go-to remedy for countless people, providing quick relief from a range of everyday ailments. OTC drugs are used for prevention and symptomatic relief of minor ailments. The precautions that must be observed when dispensing OTC drugs are the following. A. The correct drug with the correct drug content is given to the right patient in the correct dosage form. So, ginabase ang drug kay ginabase dyan na sa dosage intake nato kung unsa rin makaya sa tong lawas. Like, gusto na ko i-address ni nga issue kay grabe yun ni siya ka well-known worldwide. So, this is a common problem yun nato na which is ang suicide. Na ang ginagamit nila per me is ang usually kay medication overdose is a common method in suicide attempts. Indeed, the success of suicide is based on the availability of the drug in developing countries where there is a poor control of medication access, and over-the-counter medication is common like here nga naatay mga kanang tambal nga pwede ra siya nga mapalit without the reseta or prescription sa doctor. Over-the-counter medication is common. A high prevalence of the problem can be expected since common drugs such as ibuprofen and paracetamol are commonly used medication for attempting suicide. So, di ba kabantay mo nga ang paracetamol, which is, ang pinakasikat is biogesic, na mapalit rin nato siya without a prescription galing sa atong doctor. So, kaya kailangan kita magbantay sa atong mga gina-intake nga dosage sa drugs. B. The pharmacist must counsel the patient to make sure that he or she takes the drugs correctly. So, di ba, if moadto kag doctor, like, ilag yung, if, di ba, magpa-check up ka, tapos nasa lagi prescribe ni mga medicine, then, ilag yun ng isa-isahon, nag-ingon sa imo, kung saan nga adlaw imnon, pila ka dosage, like naagi na siya sa reseta. Kay ang reseta manggod kay gakonsis siya og kung kano sa imnon, kapila sa ka adlaw, pila ka dosage. So katong gyud imong i-follow kay para katong drug is mag-work sa imuha correctly og dili po ka ma-overdose. The pharmacist must be aware of and know about the possible toxicities possessed by the OTC drugs to avoid food and drug incompatibilities and overdoses. So that's why nga ang mga pharmacists ginaeskulahan gyud nila ayo because grabe ka important ang drug sa health sa tao o kung isa lang gali kamalian na kay matwist na layo ng health. So, dapat very careful kita sa itong kinainom nga drugs and ask our doctor.
OTCs must be used discriminately. First, to avoid dispensing of OTC drugs to known identified habitual drug users. Second, to avoid complications. This is done by inquiring from the buyer of the drug as to the identity of the patient, the patient's age, and other information such as pregnancy, hypertension, and etc. Third, counseling the patient so as to avoid the self-medication syndrome by inquiring about the buyer's source of information about the drug. Most drugs act within a cell rather than on the surface of a cell or in the extracellular fluids of the body. Similar to normal body chemicals, a drug enters a cell and participates in a few steps of the normal sequence of a cellular process. These drugs may later interfere with or replace chemicals of normal cellular life, hopefully for the betterment of the person.
Take it from the Falcon squad. Let's always be mindful and responsible. Because if you won't,
delete drugs, or they will delete you from this world.